Հաղորդման հովանավոր Dignity Health Glendale Memorial Hospital.
Hi, my name is Dr. Manuel Momjian. I'm practicing at Dignity Health Glendale Memorial Hospital. For common colds, most people don't know when they need to stay home or when they need to go and see the doctor. If you're having fevers for more than 3 days, cough that just doesn't go away, shortness of breath, or chest pain, I would recommend that you go and consult with your doctor.
Բարի երեկո սիրելի բարեկամներ։ Այսօրվա մեր թեման բոլորովին դարբեր թեման է։ Մենք ընդհանրապես կխոսենք առողջապահության մասին, դարբեր հարցերու մասին, առողջապահության շրջանեն ներս, բայց այսօրվա հարցը mental health-ն է։ Հայության մեջ կամ մեր համայնքի մեջ mental health-ը, որ մտային հիվանդությունները իսկապես թեման է, որ մարդիկ տարիներով չէին խոսած, բայց կարևոր է, որ այս հարցը մենք լուծենք եւ ունենք երկու մասնակիցներ, հայ մասնակիցներ մեր ստուդիոյի մեջ եւ պիտի լուծենք այդ հարցը այս գիշեր։
Մեր օրերում կյանքի լարված բնույթի, առօրյա սթրեսի, հասարակաքաղաքական եւ անձնական ամենատարբեր գործոնների ազդեցության ներքո զգալիորեն աճել է հոգեբանական բնույթի խնդիրների թիվը։ Մինչ հոգեկան ինքնազգացողությունն ու հավասարակշռվածությունը ոչ պակաս կարևոր է, քան ֆիզիկական առողջությունը, շատերը հոգեբանական խնդիրները դիտում են մակերեսորեն, կամ էլ նույնիսկ ամենևին էլ չեն գիտակցում դրանց առկայությունը։ Որոշ հիվանդագին դրսևորումները այդքան էլ հեշտ չէ ճանաչել։ Օրինակ, հաճախ անհատը կարող է դեպրեսիայի ախտանշանները վերագրել գերհոգնածության կամ այլ արտաքին գործոնների ազդեցությանը։ Շատ դեպքերում անհատն անգամ գիտակցելով այս կամ այն հոգեբանական բնույթի խնդիրը խուսափում է օգնության դիմելուց։ Մինչդեռ նման դեպքերում մասնագետի միջամտությունն ու խորհուրդը կարող է կարճ ժամանակահատվածում ազատել հոգեբանական բնույթի խնդիրներից։ Այս եւ հոգեբանական առողջության տարածված այլ խնդիրներով է զբաղվում Armenian American Mental Health Association-ը։ Հայ-ամերիկյան հոգեբանական առողջության ասոցիացիան ոչ շահութաբեր կազմակերպություն է։ Հիմնադրվել է 2006 թվականին։ Ներկայացնում է հոգեբանության եւ հոգեբուժության, ամուսնական եւ ընտանեկան թերապիայի, հասարակական ծառայությունների բնագավառում գործունեություն ծավալող հայ ազգի մասնագետների։ Կազմակերպության նպատակն է բարելավել Միացյալ Նահանգների հայ համայնքի հոգեկան առողջության ծառայությունները։ Կազմակերպության առաքելությունն է ստեղծել բարձրակարգ մասնագետների ցանց, որոնք կարող են վարել կրթական ծրագրեր, տեղեկացնել եւ գնահատել հոգեկան առողջության ծառայությունների անհրաժեշտությունը եւ նպաստել հայ-ամերիկյան համայնքում հոգեկան առողջության հետազոտման խթանմանը։ Այսօր մեր տաղավարում ենք հյուրընկալել Հայ-ամերիկյան հոգեբանական առողջության ասոցիացիայի նախագահ հոգեբույժ Raffi Tashjianին եւ վարչության խորհրդատու հոգեբան Charles Pilavianին։
Սիրելի բարեկամներ, ինչպես ասենք, այսօրվա մեր թեման է մտային հիվանդությունները եւ այսօրվա երկու մասնակիցները մեր հետն են Dr. Raffi Tashjian, psychiatrist, եւ Dr. Raffi Charles Pilavian, PhD, մասնավոր, neuropsychologist։ Եվ ասոնք մեր գազագերբության հայ AAMHA, հայերենով գուզեմ որ թարգմանել, բայց դժվար է հայերենով թարգմանելու հայկական միություն մգա որ մասնավոր mental health-ի համար է եւ mental health-ի մասնակիցներն են ասոր մեջը։ Բարի եկացեք։
Բարի տեսանք։
Dr. Tashjian, ցուկ գուզեք անգլերենով խոսիլ կամ հայերենով։ Այո։ You're the president of AHMHA. Երբ սկսած ես կազմակերպությունը? When did you start this organization?
The Armenian American Mental Health Association started around 2006 in Los Angeles. It's a non-profit organization composed of professionals in all fields of mental health, which includes psychiatrists, psychologists, licensed clinical social workers, licensed marriage family therapists, and nurse specialists. So in 2006, the Department of Mental Health in Los Angeles wanted to address mental health needs of minority communities, and the Armenians, being a minority in this county, were not represented. The Department of Mental Health usually gives guidance, funding for programs to address the mental health needs of those minority communities. And since the Armenian community was not represented, we came together, a few professionals, and decided that we should create an association to be able to represent those needs to the authorities and get funding and start programs to be able to meet the needs of the community. So these are all volunteers. We do not have any major funding or grants or anything like that. So we dedicate our time to really educate and increase the awareness amongst the Armenian community about mental health issues, which is not any different than any other community. So our association evolved over the years, so we have a good number of professionals who came together, and as we come together, we are a force to be represented towards the mental health organizations. So we provide lectures, seminars, we partnership with regular health fairs to give access to the community more about knowledge and understanding, and in a way to really diminish the level of stigma that is amongst the population towards mental health treatment.
How many members in your association?
We average about 60 members, active members, and we have a board composed of 9 people, nine professionals. It's a hands-on board, and we really dedicate all our effort and time to that, to fulfill the mission of the organization.
There is an Armenian Medical Society. Are you guys member of that, or just totally independent of Armenian Medical Society?
Our organization is separate, and we have had contacts and discussions about joining and having joint efforts, and at this point we are maintaining our individual organization as such.
Dr. Pilavian, how long have you been member of the organization? From the get-go?
Funny that you ask. The two of us were one of the founding fathers.
Oh, you started it with him.
We started it at the same time. So we found each other. There was the matriarch of Armenian American mental health, Dr. Emma Oshagan. So she was also part of the board, and we came together, as Dr. Tashjian said. It was an effort, an initiative taken by Los Angeles County Department of Mental Health to bring us up to speed, because every other minority groups were represented. The Armenians and a few other minorities were underrepresented. And so this is how we started our group. And since then, we have partnered with several larger organizations. As you mentioned, the Armenian American Medical Society, they have health fair every year.
Right.
We're always partnering with them. We are represented there. We have a stand, and we try to contribute or to answer any questions from the public about mental health. We have partnered with the Armenian Nurses Association. That's another wonderful group of professionals. We have interacted, and oftentimes we went to lecture to provide them with lectures and education, and they provided us in return. So there is a very nice cooperation amongst the 3 Armenian larger organizations. And we should also mention ARPA. ARPA is another Armenian professionals. I think it includes engineers, writers, teachers, another group that they are very, very active both in the United States and in Armenia. So we have just had a joint conference with them on women's status in Armenia after the fall of the Soviet Union. It was very, very fruitful conference.
Do we have, the Armenian Medical Society have associations, or at least overall with other countries, especially in Armenia and so forth? Do you guys have any association outside, let's say, California?
Currently, we do not have, but we are seriously considering to kind of have working relationship with mental health providers in Armenia, to provide them with training, with opportunities to do research, to have a good working, medically based, association. And we're hoping that we will be able to achieve that goal very soon.
If I may add,
Sure.
So it's several of, with the advent of social media, they are finding us. They are the ones who are taking initiative. Several mental health professionals from Armenia, Yerevan. And I'm currently I will be guiding and supervising someone's dissertation. She's writing on a topic, and she asked me to be her supervisor. We should mention, one of our board member, Dr. Shake Kefterian. She is a Fulbright scholar, and she's teaching at the University of American University in Yerevan. Mm-hmm. And she has established several bridges between us and them, and hopefully this will carry fruit down the road.
We're going to take a short break. When we come back, that's part of being on television, we're going to discuss what are the common ailments, I should say, maybe that's the wrong word to use, in the Armenian community. What are some of is it different than the population at large, or we have something common among the Armenians? So we're just going to discuss that. We'll take a short break. Սեր պայգամներ գաչ թաթարեմ հետը պիտի վերաթարնակ մեր հայդակրին։ Սեր պայգամներ, ինչպես ասենք, այսօրվա մեր թեման է առողջապահությունը, մտային առողջապահությունը, անորոշ երկու մասնակիցներ ունենք, այս թեմայի մասին կզրուցենք։ Is there a common ailments among the Armenian population, or it's pretty much same as any other population? Do we have, as Armenians, as Armenian Americans, do we have anything unique among us, or it's the same for anybody else? Well, maybe that's a tough question to ask.
Well, mental health and mental disorders are universal, basically.
Right. Like depression is depression.
Depression is depression anywhere you go, with some modification, with some specific characteristics to each community, to each culture, and to each environment. I mean, as we know, depression, is a well-known condition that can be affected by the environment. So on top of its own biological, cause. So if the environment is different, then the manifestations may be a bit different. And in our own situation, with the Armenians having sustained major traumas in its history, and with the recent immigration of people to Los Angeles, let's say from civil war countries in Lebanon or Syria or Iraq or other areas where people were forcefully moved and came to a new environment, all that affects the manifestations of the depression, let's say, or the anxiety with post-traumatic stress disorders. But overall, our these conditions and disorders are not much different. And we have to address the fact that we can determine the condition, keeping in mind the background and the surrounding pressures and conditions that will bring the disease or the condition into a manifestation. So we, as Armenian mental health professionals, we have to be aware and sensitive to those issues. That's why we think, as well as the Department of Mental Health in Los Angeles, is sensitive to the fact that we should create programs that is geared specifically to the Armenian community, because their language is different, their culture is different, their structure, the way they interact, the way they value certain things is much different than other communities. So we have to work in a way that we integrate our knowledge about mental disorders as well as incorporate the cultural background and the effect of that on the condition.
So do we have something unique? Because what we went as a trauma, as a nation, 100 years ago, I mean, we've been, now it's, pretty much immigration to this country. I mean, besides depression, I mean, the split personalities we have, or maybe other, I mean, there's only like 3, 4, 5 diagnoses in psych. So are these not applying to us?
Well, in general, basically, we cannot neglect the fact that trauma is a major effect on mental health.
Right.
And when the trauma is magnified with several episodes and over the years, obviously that is going to translate into more depression, to more anxiety disorders and all that. However, recognizing all those factors, we have to recognize as well the fact that Armenians in general are not open to seek, care and resort to the appropriate means and ways to get help. We tend to suppress, we tend to maybe live with it and suffer with it, unfortunately, when there are options to try to get the appropriate care and level of care that is needed.
Well, this type of topics were kind of taboo. I mean, you don't talk about it. Just recently people start talking and trying to seek treatment. But for a long time, I remember from my childhood, I mean, somebody, you put it away and nobody wants to talk about it,
Yes.
Yeah.
Right?
So recently, we have addressed this by partnering with Armenian Relief Society. We partnered with D.D. Hirsch, Pacific Clinics, and we invited National Association on Mental Health, NAMI.
NAMI, yes.
And we partnered with them, and we had a very successful conference to address these issues. We took the lead. We had it at Glendale Library, public library. And so the point was to understand what these organizations had undertaken to address culturally sensitive services to the Armenian public. And each one of them, they did their presentation, and they spoke about very specific things, sensitive things that pertains to our community, which was very encouraging. So our role as organization, as mental health association, we were trying to play more and more important role in taking the initiative, making this what we call stigma and taboo our target, to demystify it, to make it as an acceptable. Like many scholars and intellectuals have said, what's the difference if you have diabetes or you have anxiety and depression? It should be treated the same. They are all disorders. They are all deviations from the norm. And therefore, we can address it in a very acceptable, but the individual has to accept it, first of all, to say, yes, I have a problem. I need to seek professional help. And we do what we can to keep it confidential. For example, where I work, we have a waiting room. The entrance is separate from the exit.
Exit, yes.
So to maintain confidentiality, to me, I've been in this field since 1992. I have practiced my profession on 3 continents, Europe. I was invited to Haigazian University in Beirut to establish a mental health clinic in Beirut, and I worked there and I came here. So just to return to your question, you said, what's unique to the Armenians?
Right.
I think we are the member of the international community. Wherever you go, there is 1% of the population, they have schizophrenia. 1.5, they have bipolar disorder. And another percentage, they have depression, anxiety. So we are not any different from the
general
world.
population.
But what is very funny with the Armenians is we don't believe so much in free will. Because if you're seeking therapy, you need to understand that, like, մենք ջագադա քիրիգա հավատանք, ամեն ինչ կսենք Աստված ուզեն է. And but I learned in Lebanon because I couldn't do therapy, and because many of them would say, Աստված այդպես կուզե, որ ես չարչարվեմ. So I had to overcome this hurdle. And
Որ Աստուծո հետ կապ չունի. I mean,
որ Աստծո հետ կապ չունի.
Քրիստոնյա ժողովուրդ ենք, we're Armenian Christians, but it's a medical issue as opposed
But
to
I'm getting there.
given from God.
I would say we are, as religion, as Christianity, the disciples said, if you going to, they said, every human has free will, you are free to do whatever you want, but when doomsday comes, you are responsible. And that was a good hypothesis to take from the Bible and use it and say you have free will. So I'm not trying to preach Christianity here, but I'm saying that where in many ways we're a little bit different from the others because we are deterministic. We don't believe so much in free will.
Go ahead.
I may add as well that it's changing. There is a
Perception is changing.
Acceptance is changing. Like when I was in practice in the 1980s, I was one of the few Armenian-speaking, psychiatrists or mental health provider in Los Angeles. And since then, things have changed so much. The number of therapists that's available for the Armenian community to make use of, we have about maybe 500-600 therapists now in the Glendale, Pasadena, Burbank area alone who are in private practice, who are working in clinics and providing help for the Armenians. So it's evolving, it's slow, and we need to work continuously on trying to bring the awareness more and more and less resistance from the people.
Because there's some general common themes, divorce, let's say, which is very phenomenal, I guess, being in this country or in new society. People are not tolerant, they get divorces, wives that, now left with children to take care of, depression in that. Do we have some of these common issues that the American public at large have, or something maybe unique for us as Armenian Americans?
I think in general, we are living in this society. Right. And, as you mentioned, the family structure has changed in the Armenian community as well. Both spouses work. Right. Children are sent to school, and then the mother is at work. So, and the extended family structure is changing as well. So the whole community is adapting to the American culture and the American standards, and it's becoming part of our community's problem as well because of the adaptation, and the children are at school, they are integrated, they do face the same problems with drug substance abuse problems or behavioral problems. So it's merging, it's becoming more and more the same across the board. And we have to keep working at bringing awareness that those are issues that we need to take seriously.
Yeah.
Is the drug abuse a big phenomenon in the Armenian community?
It is.
It is.
Yeah. Using drugs?
Yes.
Absolutely.
It is.
Do we have a specific program for detox?
We have a detox. We have detox, and we have a drug rehab specific Armenian center in Pasadena, where the professionals are all Armenians. So yes, it exists. But we are not any different percentage-wise. Our youth are becoming addicted to opioids, like
the public is, the general public is.
So this epidemics is also affecting us. Well, those are one of the misfortunes of being assimilated in this society. There are very many positive things, which is women's liberation, adaptation to the society, and becoming active members of the American community. But at the same time, we are also being affected by social maladies such as drug addiction, divorce, the disintegration of the Armenian family, because we are not any different than the rest of the country.
The other issue, which is, again, it's hard to discuss, is alcoholism. Is that something in our community? Is it more widespread? Armenians in general, they drink and they just get drunk. That isn't. It's an issue that splits families, splits fathers from their children, and alcoholic, let's say. Is that something that we face?
The challenge is, well, if I may, I can divide the group of the people who use alcohol roughly into two groups. Those are the ones that become alcoholic and no longer functional, and those are the ones who continue to drink and they are functional. Mm-hmm. Like they continue to go to work, for example. But outside of their work, they cannot function as becoming an active member of their families. So alcohol is a problem whether you belong to this group or to that group.
Let's take a short break. Sure. When we come back, we'll discuss. We'll continue these discussions. I mean, they're difficult topics to talk, but I think something that we need to discuss openly.
Absolutely.
And as I said, these were taboos, even in the American public at large. But at least lately, people are talking about it, and we as Armenian Americans, we need to discuss openly, and we'll talk about it when we come back. Սեր պայգամներ, գաշ թաթարամը հետը պիտի վերաթարնակ մեր հայդակրին։ Սեր պայգամներ, ինչպես ասենք այսօրվա մեր թեման է առողջապահությունը եւ մտային առողջապահությունը։ Մեր հայերուն մասին խոսենք. Let's talk about the Armenians. We are a unique people. Միշտ մենք կսենք, որ we're a unique people, չէ՞։ We had genocide in our history. We had, people left our homeland, whatever survived the genocide. Now, the last 30 years or so, depopulation in Armenia to other countries, diaspora, and people moving to the United States and building new homes and so forth. So clearly, not only the genocide, which, for 50 years we never talked about it. I remember when I was going to school in Lebanon, they never talk about the Armenian genocide. At least my grandma would not talk about it. It was just such a taboo. No, she says to me. We have went through very bad things. We were sent to Deir Zor to die. We survived. We don't want to talk about it. But now we're talking about it. Same thing, I think, applies to us as a nation. Because what we went through our history, the last 100 years, genocide, immigration, settling. I mean, my family, and I'm sure it's similar to other Armenian families, in a 100-year period, we settled in 3 countries. Yeah. Turkey, Lebanon, US. So all in a 100-year period. We built 3 homes, basically. How do you professionals look at this? When you look at it from outside and seeing that in your patients?
Well, it's a very interesting question. So we needed it. We, as mental health professionals, we always try to have perspective on phenomena, human behaviors, emotions, attitudes. So years ago, I came across a theory called transgenerational transmission of emotional issues, and that was the author was American. And I thought it was like a very interesting theory to adopt it and explain the Armenian genocide. So what our grandparents have experienced, some of them spoke about it, some of them authored books, but many of them, as you're saying, like your grandparents, kept it a taboo. They didn't speak about it. They had many thoughts with that. They were thinking, we don't want to transmit my trauma onto the coming generation. Or they didn't have the courage to reopen the wounds of the genocide. So it can be explained in many ways. But even though, and this is something that an Israeli researcher by the name of Natan Kellerman, whom I met not very long ago at a conference, he has done research and he has come to the same conclusions as, so whether or not it's the Holocaust or the Armenian genocide, the patterns are the same. So how are the families very different from nations who did not experience genocide? They are more dependent. The members of, like let's say the Armenians, we are much, much more dependent on one another. We always expect, Norem pam maga, norem pam bidi illa, portsank kagan galeng. Like we expect the worst thing, which we call fortune telling in psychology.
But I mean, look at our history.
It is.
I mean, you know, as I gave my family's example, in 100 years, 3 separate countries we settled. And I'm sure it's the same
the
to every Armenian
Jewish,
family.
the Jewish community is like us. So their studies, they are very similar to us, very consistent with our findings. And many of our Armenian community members, they don't get married. They stayed unmarried, like the Jews. And we become cynical. Cynical in the sense that we trust more Armenians than non-Armenians. So those are very universal. I think the same findings were found with this recent, like Sudan, in southern Sudan, and the genocide in Darfur.
Darfur.
Yeah. So we took, again, another initiative in 2015. We had a very successful conference. It was packed at the Glendale Community College. Many researchers, prominent researchers in genocide, psychologists, sociologists, and then recently, one of the greatest developments happened. I was personally invited at a conference organized by the Jewish community, and it was on the Holocaust, and it was called Inheriting Genocide. And they included us as an Armenian lecturer, and it was very successful as well.
Dr. Tashjian, I have a question. I mean, in the mental health issues, it's really difficult for the person to say, I have a problem. I mean, if you have a pain in your body, you go to an internist, you say, I have this problem, you know, or you have an issue, you go to a surgeon, it's easily you explain your problem and hopefully it's taken care of. But in mental health issue, the patient has to say, look, I'm crazy, or I'm putting it blunt way.
Yes.
I mean, how would anybody would say, look, I have an issue and I need to go to a psychiatrist?
Yeah.
Isn't that the major issue? Unless your family or your wife or your spouse is going to bring you to a psychiatrist. I mean, most people will not say, oh, let me go see a psychiatrist. I mean, you know, it's like, number one, it's a taboo. Number two, you're not going to come to that conclusion yourself.
Yeah. Well, unfortunately, the stigma started with the concept that if I have a emotional, mental condition, I'm crazy. That's how people usually labeled it for years and years. And that's far, far away from the truth. Mental health does not mean that a person is crazy. You can have anxieties, you can have depression, you can have many other emotional manifestations that are far, far, far away from being, delusional or psychotic or so-called crazy. So that's the step that one has to understand, that when you decide or you want to go and seek help, you're not crazy. There's no question about that, and you should feel comfortable with yourself to do that. However, we are in the process of trying to bring awareness that, like it happened in the American society and in Europe over the years, where people became more willing to seek psychiatric or psychological care because the treatment became much more effective. Medications became much more effective with less side effects, and treatments were not long-term, like in psychoanalysis, where you had to go for years and years in order to get some benefit.
That was my impression.
Yes.
I mean, people be on this medication, lithium imbalance, let's say, they have to take it for life, and the treatments, hospitalization after hospitalization. And I remember running psych hospitals myself, being the CEO of hospitals that we have psych. These patients, like, constantly, it's a revolving door.
Yes.
They leave at the end of the month to go get their Social Security check, and they're back again.
Yes.
They're on substance abuse or whatever. I mean, just like, I see the same patients over and over again.
Yeah, and that's the concept in general that people have about the effectiveness of treatment. We have very, very specific antidepressant medications that are very highly effective. They're well tolerated with no side effects, and psychotherapeutic interventions that can be very short-lived, to the point, 6 weeks, maybe 8 weeks, once a week for an hour, and it's very effective. And maybe when people realize that there is something of that nature, and it's not going to be wide open and non-effective treatment, maybe their perception of it would become, different. However, I think on the other hand, the issue is that, we tend to keep things to ourselves, and that's fine. But I can, as if I'm suffering, let's say, from an anxiety and or having panic attacks or certain special phobias, maybe I can go online and do some research and read on my own. There's a ton of information at the American Psychiatric Association, the NIMH, all kind of websites that you can go and read about it, and then realize, do I fit? Does this seem to be something that I'm suffering from? Maybe I can seek help. And if you do want to seek help, you don't necessarily have to start with seeing a psychiatrist or a psychologist. Talk to your family doctor first. Get an opinion. Get a referral.
I manage hospitals. This is what I do. But a lot of, unfortunately, the perception among the physicians, the internists, the family practitioners, I'm not going to touch that. Let me refer it to a psychiatrist. Get them out of my office. I mean, that's the perception. Yes. I mean, I know you're saying that, but reality is different.
But when it comes to the patient, that's a first important step, that they have decided to talk about their problem to their doctor.
Right.
And if the doctor is
I was going to say, okay, let me refer you to the psychiatrist.
Yes.
Boom. This goes.
And that's where maybe
even we need to educate our own physicians, I think, to have this different perception. It's not the public.
Yeah. Yes. And another opportunity that people have nowadays, what is called telepsychiatry. You do not have to leave home to get treatment.
Right, I'm aware of that.
Yes.
We have it in our emergency rooms. We're going to take a break. When we come back, we'll talk. I mean, we're almost at the end of our show. We have the last segment, so we'll talk some more about some of the more advances that you're hinting to. Սեր պայղամներ գաշ տատարամը հետո պիտի վերաթանակ մեր հայդակրին։ Սեր պայղամներ այսօրվա մեր հայդակիրն է մտային հիվանդությունները եւ այսօր մասին աստեմայի մասին մենք գզրուցենք։ Just before the break, we were talking about the issues related to unique to Armenians, and some of the mental health illnesses are universal, obviously, they're the same. What about children? You know, is there, because I managed, and this is one of the most painful things in my career was, I managed a psych unit specific for children. It was the most difficult thing. And me, a 30-year professional in healthcare, I just couldn't put myself going into next, even close to that unit. Is this something in the Armenian community? Is something that you guys face as professionals?
Mm-hmm. Well,
children is as young as 4 or 5 years old.
Yeah, of course. So there are, just allow me to go back to one topic. So every profession, like medical profession, has its chronic illnesses. So do we. There are a few chronic illnesses in psychology and psychiatry, but in general, most of them are treatable. There is this issue of awareness. Am I aware of my own difficulties? And what do I do with them? So there are certain symptoms that everybody else around you, they are aware of. It's called personality disorder, but you are not aware of them. There is another one that is, you are aware of them and you keep them to yourself. For example, during the Victorian era, the women had several difficulties, anxieties. They would keep them, and they called them hysterical because they would have somatic symptoms instead of psychological. Now let's go back to Armenian community. We tend to convert our anxiety, depression, and shame and guilt into somatic symptoms like abdominal pain, migraines, pain in my shoulders. So those are conversions of emotional issues into psychological. This is very common. And in Armenian community, we say, «Edինչ մարդ է, որ եթե հոգսեր մարմնային կամ հիվանդություններ չունենաս, edինչ մարդ է». So we think that way. We tend to somaticize more than many other communities. In terms of children, there are several kinds of disorders in children. We divide them in emotional and cognitive, like dyslexia, attention deficit. Mm-hmm. We have also oppositional defiant disorder, that they are always in opposition to their teacher and authority figures.
Families,
parents, authority figures. And it can develop into sociopathy. It can develop into, like, they become in conflict with the law. And that's why, like adults, if we become sick, we have something to fall back onto, but children don't have it. Therefore, parents are hereby encouraged not to wait for too long, seek help, seek second opinion. If you choose, like Dr. Tashjian said, take your child to their general practitioner. It's okay. And from there, they can be referred here or there. But children should get help as early as possible. There are several. As emotional, sometimes depression in a child it doesn't manifest itself like in an adult. The child
it's
becomes,
unique for a child.
Yeah, like bedwetting. It can be, they stop going to school, they isolate themselves, they become irritable, they become, so one of the indicators is when their grades drop. So parents have to gather all these kinds of information and be alert and see what's going on with my child and seek help early and not to postpone. Be proactive.
What about elderly? So let's talk about the children.
Sure.
Let's talk about elderly, especially after they lose their spouse in the 80s and 90s. People are living longer. I mean, they're alone. What are some of the unique issues they face in the Armenian community?
Certainly depression becomes a very important response to a major loss and change of life. You know, and
they're alone now. They lost
totally
their companion.
And if they lack the family support system, they're in an environment where they cannot speak the language, they cannot drive, they're totally becoming more and more dependent on others, it becomes a very, especially in the male population amongst the Armenians, who have always been more independent and the breadwinner usually. This is the old Armenians. So they manifest with a lot of their depressive symptoms and even suicidality. You know, it's something to keep in mind, especially when the person is living alone.
Have you guys, a professional, faced suicidal things from your patients that are
Absolutely,
Armenian?
Absolutely. You know,
or at least having suicidal thoughts.
It's as common as any other community and any other society, and we see that happening, especially as we know, the second leading cause of death is suicide in the age group of 15 to 44. So these are very high-functioning young individuals who are the most prone to suicide, and we see that amongst the Armenians as well. And as family members, as friends, and anybody who's involved in that person's life, we have to be on the outlook and really make an effort to reach out and let them speak about their feelings and guide them towards treatment as soon as possible. The taboo was not, let's not talk about suicide.
Right. Of course.
That's not acceptable.
I mean, all this
absolutely.
Psychologist issues were kind of taboo, even in the American public.
Yes.
But even more taboo in the Armenian community because, well, he's crazy. We don't know. I mean, you don't want to be labeled that.
That's right. So, I mean, as soon as you have any hint that the person may be suicidal because they're depressed, they become seclusive, they avoid interaction, they start talking about what's the purpose of life, take it seriously and take it to the second level of trying to get help for them before it's too late.
Any final thoughts?
Yes, of course. I concur everything Dr. Tashjian said. There is also an aspect of increased early dementia in individuals who become isolated, in despair after losing their spouses. Some of them, they will also lose their driver's license.
They can't drive,
and they cannot drive, and it affects their manhood because all these years I've been driving independent. Now my independence is compromised. Luckily, for anyone out there who has an elder at home and you feel like they match the description we just discussed. Luckily, nowadays, there are adult day healthcare centers, and they are Armenian adult healthcare. They will be among their peers. They provide a very nice social environment. They have Armenian nurses, social workers, physician, and it's all under the same roof, and it's a very, very good place to be. It's safe, and it's covered by Medicaid.
It's good covered. Any final thoughts before? We're almost at the end. I mean, it was a very, very interesting topic.
Well,
it's a difficult topic, but I think we went through.
What we didn't cover here is the family dynamics, but maybe next time.
Maybe we'll invite you for that specific point.
We did not discuss brain injuries,
well, these are,
organic.
Exactly.
But it's also part of mental health. Yeah. Like, for example, attention deficits, that is
in a school
prevalent,
children, yes.
Of course. My final thoughts are, we are human beings like you or just anyone else, even though we are psychologists and psychiatrists. We are approachable. We are nice people to talk with, and just find a psychologist or psychiatrist to discuss and consult with. And it's not the end of the world.
Dr. Tashjian,
I would emphasize the need for people to get to know more about their own personal inner feelings and conditions that they're suffering from. As I said, the website is full of information that they can take their own tests and see what kind of condition they may have, as well as our website has information about Armenian-speaking therapists and doctors and all that who can be used in case they want to seek treatment and get consultation with. And there's no shame in anything of this to get the help, because you're not just the only person who's suffering. It's the people around you who are suffering as well. Your spouse, your children, your family, everybody else is affected by your own suffering. So I think the benefit is tremendously affecting everybody else and for the well-being of the family.
The common good of the family.
Well, thank you so much for a very, very pertinent, very, very important, and a difficult topic as well. But I think we covered it very nicely. I appreciate you being on my show. I thank you so much.
Thank you for having me.
Oh, sure, of course. We know for many, many years. So
thank you.
And I thought, this was a very important topic for our public. Thank you.
Thank you.
Սեր պայգամներ գբերչացնենք այսօրվա մեր հայդակիրը, բայց կուզեի մի վարգյան մարնել եւ խոսիլ ուրիշ ավելի հարցի մասին, որ միտքիս մեջ է, անշուշտ այս հարցը մտային առողջապահության մասին խոսեցանք, բայց կուզեմ վարգյան մարնել եւ Հայաստանի մասին խոսիլ, որպես հայ, որպես ամերիկահայ։ Նորեն շատ ցավալի է ինձ համար տեսնել տելևիզիոնի վրա, որտեղ մենք հնչենք Հայաստանի վիճակը այսօրվա։ Ես միակ մաղթանքս եւ աղոթքս է, որ մեր ժողովուրդը միանա եւ մեկ լա եւ ովևէ նեղություն չունենա։ Կմաղթեմ, որ Հայաստանը լավ լա եւ իմ աղոթքս է, որ ունենանք հաջողությունը, ինչպես կսեն at the end of the tunnel there's a light. At light-ը լույսը մեզի մեր ժողովրդին կա, որով շատ չարչարված ենք, ինչպես ասենք, 100 տարվա ցեղասպանություն եւ այլն արտակախտ եւ մեր ժողովուրդը պետք է լավ ապրի եւ ես մեր հայ ժողովրդին եմ գեցե Հայաստանը եւ գեցե մեր հայ ժողովուրդը գիշեր բարի
Հաղորդման հովանավոր Dignity Health Glendale Memorial Hospital